Hello and welcome. Today we're going to talk about a really important and sensitive topic, the medical journey of managing and preventing pregnancy loss. We're going to cover everything from the immediate, life-saving actions in a crisis, all the way to the proactive strategies that can help protect future pregnancies. So, let's dive in.
So here's our game plan. We'll kick things off with those critical first steps in an emergency. Then we'll look at the different treatment options on the table. We're also going to cover something called the RH factor, which is super important for future pregnancies, before we shift gears to prevention. And finally, we'll wrap it all up with a quick summary of the essentials.
Okay, first things first. Let's tackle the most urgent scenario. When a patient comes in with heavy bleeding and is showing signs of shock, the response has to be immediate, and it follows a very specific, life-saving playbook.
So what do you think is the absolute #1 priority in that moment? It's actually not figuring out why the bleeding is happening. Not yet anyway. It's about one thing and one thing only, keeping the patient stable and alive.
And this right here is the answer. Clinicians immediately jump to the ABCs. They make sure the airway is clear, breathing is stable, and then all focus shifts to circulation. That means getting 2 large IV lines started, pumping in fluids to fight the shock, and getting blood matched and ready for a transfusion just in case. The main takeaway here is absolutely crucial. Stabilize first, investigate second.
All right, so once the patient is stable, the next big decision is, how do we manage the situation from here? And broadly speaking, it comes down to 2 main paths, medical management or a surgical approach.
Okay, so option 1 is medical management. This basically involves using a medication called misoprostol. It's a type of prostaglandin that gets the uterus to contract and the cervix to soften, which helps the body naturally expel any remaining tissue, all without surgery.
And then there's option 2, surgery. This involves procedures like an MVA or the more well-known DNC. The goal here is to physically and, more importantly, immediately clear the uterus. This is often the way to go when there's very heavy bleeding or if the medical approach doesn't quite work.
Now, this slide does a great job of laying out the trade-offs, right? On one hand, medical management is non-invasive, you avoid anesthesia, and there's less potential trauma to the uterus, but it's a slower process. On the other hand, the surgical route gives you an immediate solution, which is a lifesaver in a hemorrhage, but it is an invasive procedure with its own set of risks, like uterine perforation or developing scar tissue.
Okay, now let's talk about a small but absolutely critical step in this whole process, one that has huge implications for future pregnancies, and that is the RH factor.
So here's how it works. If a mother has Rh-negative blood, but the fetus is Rh-positive, any mixing of their blood, which can definitely happen during a miscarriage, can trigger her immune system to build antibodies. The problem is, those antibodies can then attack the red blood cells of a future Rh-positive baby. Anti-D immunoglobulin is like a shield. It steps in and stops her body from ever creating those harmful antibodies in the first place.
And this is the part you really need to remember. This protective shot has to be given within 72 hours of the bleeding event. It's a race against the clock. Getting it in that window is absolutely essential for protecting the health of every single pregnancy that comes after. Okay, we've talked about the crisis and the immediate treatment. Now let's pivot and look to the future. How can we shift from being reactive to proactive? How can we help prevent this from happening again?
Well, prevention is a multi-layered approach. It always starts with optimizing general health. Getting diabetes under control, making healthy lifestyle choices. But when we're talking about recurrent loss, it becomes a bit more like detective work. We're looking at specific interventions like genetic counseling or targeted treatments for physical and immunological issues.
So one of those key physical interventions is something called a cervical cerclage. Let's say a patient has what's called an incompetent cervix, which just means it's weak and tends to open up too early in the second trimester. This procedure can be a total game changer. A surgeon basically places a stitch around the cervix to reinforce it and keep it strong and closed.
And the timing here is everything. This little preventative stitch is usually put in place between 12 and 14 weeks of pregnancy. It stays there, doing its job, providing that crucial support for months, and then it's removed around 37 weeks so that a normal delivery can happen.
Now, what about an immunological cause? Well, there's a condition called antiphospholipid syndrome, or APS. It's an autoimmune disorder that can cause these tiny, dangerous blood clots to form in the placenta, which can block nutrients from getting to the fetus. The treatment, believe it or not, is pretty straightforward. A daily combo of low-dose aspirin and heparin to help thin the blood and stop those clots from ever forming.
All right, we have covered a ton of ground.
from the emergency room all the way to long-term prevention. So let's bring it all home with a rapid-fire summary of the whole topic.
This table is just a perfect snapshot. So for causes, abortion is the most common reason for early bleeding, but an ectopic pregnancy is the most dangerous. For etiology, or the reason why, it's often fetal, like chromosomal problems, especially early on. We classify them based on what we see clinically, from threatened to septic. Management? We've drilled this in. Stabilize first, then confirm, then evacuate if needed. Special care includes things like antibiotics for infection and that critical anti-D shot for Rh-negative patients. And finally, prevention is all about controlling underlying conditions and using targeted therapies like Cerclage or APS treatment.
And that really brings us to our final thought. When we move past just treating the event and start to truly understand the why behind it, whether it's genetic or structural or immunological, it changes the entire conversation. It transforms a feeling of helplessness into a concrete plan of action. And that empowers everyone involved, both patients and clinicians, on the path to a healthier future. Thanks so much for joining me.